Hello everyone, very good evening to all of you. I hope you guys are listening and you can just raise your hands if you can hear me properly, if I'm audible or if there's any break in between. You just have to raise your hand if everything is fine. Okay, great. So, good evening everyone. Welcome to one more episode, one more chapter of a very important topic in your otology. Right? We are reading ENT. So, we have started with ear. And inside ear, this forms one of the most important topics, not only from the exam point of view. In your professional exams, this will be a question. If you go for your NEET PG exams, it will be a question. If you go for INI-CET, there will be questions. If you go for FMGE, there will be questions. So there will be a plethora of questions that will come from this particular topic. And I always call this particular structure as a mystery box. Why? Because one, it is very difficult to understand. It is very difficult to imagine. Because of the intricate anatomy, we usually miss out and we start mugging this particular structure up. And I don't want you all to mug up this structure. I want you all to examine, to see, to imagine, as well as find out why a particular pathology happens in what segment of that middle ear. So we are going to read the middle ear not as a form of a structure जिसमें एक 6 side का box होता है. We are going to do a middle ear in the form of imagining it in every possible way. How it looks from the front, how it looks from behind, how it looks from the top, how it looks from the side, everything. क्योंकि प्रॉब्लम ये है ईयर में कि whenever we read ear, हम पढ़ते एक डायमेंशन में है. We operate in some other dimension. We read the scans in some other dimension. So this three-dimensional anatomy has to be crystal clear in order to master pathologies like acute otitis media with effusion, chronic otitis media, cholesteatoma, and so on. तो हम बहुत धीरे धीरे पढ़ेंगे. We are going to take our own sweet time and we are going to understand as well as uncover the mystery box. I call it the mystery box challenge. What is the middle ear all about? Chalo. So I am excited. I hope you guys are too. Let's figure out this important structure. What is the middle ear? Chalo. Now, before going into anything, let's first see what we are going to read into it. Okay. So what are the things that I'm going to cover in this particular segment? Let me just jot it down. I'm going to cover the concept and development of middle ear. Before going into anything, we are going to see the embryology of middle ear. We are going to see how the middle ear is formed. After that, we will form something called as the middle ear cleft. What is this middle ear cleft anatomy? What is the petrous part of temporal bone and all of those things? We are going to uncover that segment. After that, we are going to go into more detailed anatomy and we will see what this six-sided box concept is. What is this six-sided box concept of the middle ear? We're going to read about that. Okay. Then we are going to finally see about the lining of the middle ear. What is the lining of the middle ear or the epithelium of the middle ear? And then finally, when we are in the end, we are going to see the structures that are present in the middle ear. Structures of middle ear. That will include the ossicles, the blood supply, the nerve supply, the muscles, everything. Okay. So we are going to go in this direction. And we'll take our own sweet time to understand as well as master this topic. Okay? Chalo. Now let's go on one by one. Let's first read out what is the concept of the development of middle ear. क्योंकि embryology हमें कभी समझ में नहीं आती. Rather we don't like embryology, right? So what is the exact development of the middle ear and how we can read it is a very simple concept. When I was teaching you external ear, I told you that the whole of your ear develops from the first and second pharyngeal arch. The first and second pharyngeal arch are the main derivatives for giving our whole ear. External ear, middle ear and inner ear. Okay. So what I'm going to do, let's say this is your embryo. Okay. Let's say this is your embryo. This is the head end. This is the tail end of the embryo. Okay. And I told you that there are 6 pharyngeal arches. Okay. Total there are 6 pharyngeal arches. Let's say 1, 2, 3, 4, 5 and 6. These are our 6 pharyngeal arches. Now, in this 6 pharyngeal arch, the fifth pharyngeal arch disappears. That means only we are remaining is with 5 arches, 1, 2, 3, 4 and 6. Fifth arch disappears. We are concerned only with the first and the second arch as of now. So let me just take out this first and second arch. Okay. And let me just put it over here. Now you know there are 3 parts of a pharyngeal arch, or there are 3 linings of a pharyngeal arch. The outermost is called as the ectoderm. Okay. So this lining is of the ectoderm. Then comes the inner lining. The inner lining of the pharyngeal arch is by the endoderm. So this is endoderm, whichever is green. This is ectoderm, whichever is blue. Ectoderm. Okay. And in the center, this particular area, this is your mesoderm. Okay. This is your ectoderm. And this center one, this is your mesoderm. This is your mesoderm. Okay. And this is your first arch and this is your second arch. Okay. So what I've drawn the 3 layers of the pharyngeal arch, the ectoderm, the mesoderm as well as the endoderm. This is the first arch, this is the second arch. Now, an invagination present on the ectodermal side between the first arch and the second arch. This place, this invagination, we call it as what? We call it as a pharyngeal cleft. So what is a pharyngeal cleft? Pharyngeal cleft is an invagination between the ectodermal side of 2 arches. Okay. What is this invagination present on the endodermal side? We will call this invagination on the endodermal side as pharyngeal pouch. So there is a pharyngeal pouch on the endodermal side. There is a pharyngeal cleft on the ectodermal side. Okay. Now, one very important thing is that this ectodermal side, I have told you in your external ear anatomy that this ectodermal side starts to invaginate like this. So whenever this invagination of the pharyngeal cleft happens inside, this forms the future external auditory canal. So if I ask you what is the external auditory canal getting derived from, it is a derivative of the first pharyngeal cleft because it starts to grow inwards, right? So this is the future external auditory canal and we have discussed that initially much in detail. Okay. Now what about the pouch? This is the area which gives our middle ear and eustachian tube. Now what happens to this pharyngeal pouch? I can call it this is the first pharyngeal pouch which is present between the first and the second arch. Right? Now what happens here? Now this first pharyngeal pouch, it starts to grow. It starts to grow inwards towards the pharyngeal cleft. You are seeing? It's going towards the pharyngeal cleft. Okay. And when it reaches the pharyngeal cleft, this first pharyngeal pouch starts to expand. It starts to expand. Okay. So now the first pharyngeal pouch, as soon as it is growing towards the first pharyngeal cleft, it will start to expand distally. Okay, it is going to expand out. Now this expansion that is present here of the first pharyngeal pouch is given the future tympanic cavity. This will form the future tympanic cavity. And I told you why we call tympanic cavity is because the Greek word tympanum literally means middle ear. So if I'm talking about tympanic cavity, I'm talking about the middle ear cavity. So where is the middle ear cavity developing from? It is developing from the distal end of the first pharyngeal pouch. It's developing from the distal end of the first pharyngeal pouch, this expanded portion. And what is this proximal portion of the pharyngeal pouch going to make? If you see here, this is the proximal portion of the pouch, this is the distal portion. So if the distal portion of the pouch is making the future tympanic cavity, the proximal portion of the pouch, it looks like a tube there, right? So it's going to make the eustachian tube. It's going to make the eustachian tube. Okay, great, right? Fine. So proximal portion of the tube of this particular tube or the first pharyngeal pouch is making the eustachian tube. Distal portion, the expanded portion of this particular invagination of the first pharyngeal pouch is making the tympanic cavity, okay, or the future middle ear cavity. Now we have to give this name to this structure, right? It is forming a tube it is forming the middle ear cavity or the tympanum. So we call this invagination with a fancy name, and that name is given the name as tubo-tympanic recess. So what is tubo-tympanic recess? It is nothing, but it is our first pharyngeal pouch invagination, which is going inwards and it is expanding into a distal portion and a proximal portion. The proximal portion of the tubo-tympanic recess forms the future eustachian tube. The distal portion of the tubo-tympanic recess forms the future middle ear cavity or the tympanic cavity. Now, I hope everyone is clear on that particular area, right? Can I have a hands up on that? Right? So this is about what exactly is the future development of the middle ear cavity looks like. I've told you about the cavity till now. Now we are going to see about how these structures of the middle ear will come, right? And there is a structure, very important structures that are present in the middle ear cavity are what? They are called as ossicles, right? They are called as ossicles. So how many middle ear ossicles do I have? Ossicles means what? Ossicles means the bone of the middle ear. And there are three bones that are there in the middle ear. So what are the bones of the middle ear? Malleus, incus and stapes. Okay. So there are three bones of the middle ear. There is malleus. It looks like a hammer. Okay. We are going to talk much in detail about it. Then there is another one that is incus, which is like this. Okay. And then there is another one that is called as stapes, which opens in your inner ear compartment. So there is malleus, which joins with incus, which joins with stapes. These are the three ossicles which are present in our middle ear cavity. Okay. Now, what exactly is the development of these ossicles going to be from, or how will these ossicles develop? Now, I told you in the beginning, the center of the arch is made up of mesoderm. Now, mesoderm means what? Mesoderm means that they contain mesenchymal cells. These contain certain cells which are called as mesenchymal cells. These are cells which are called as mesenchymal cells. And these mesenchymal cells are actually derivatives of neural crest cells. They are derivatives of neural crest cells. So what are these neural crest cells? Okay. Now, whenever our embryo is developing, there is something called as a neural tube that develops. Okay. There is something called as neural tube that develops. Now, from the neural tube, some of the cells migrate out. And these migrated cells are called as neural crest cells. And they migrate into this first and second arch. So we call them as mesenchymal cells. Why? Because now they have entered inside in the mesoderm of the arch. So we call them as mesenchymal cells. Okay. Now, what are they going to do? These mesenchymal cells are going to condense. They are going to condense. The first arch mesenchymal cells are going to condense, or they are undergoing condensation, and they will form our future malleus and incus. That means the condensation of these mesenchymal cells inside the first pharyngeal arch is happening, and they will form what? They will form the future malleus and incus. Okay. Now, what will be from the second arch? This is a very important NEET question as well, where you often get confused. From the second arch arises one important ossicle only, and that is our stapes. Now, if I just take out that stapes from there and I show it to you, so stapes has got a head, it has got a neck. This is the head of stapes, this is the neck of stapes. Then the stapes has got two crura. Crura means projections, which are called as anterior crus and posterior crus. These are basically, crura means projection. And then it has got a foot plate. Now, this foot plate is the one where the stapes is rested, like this. Okay. And this foot plate opens in our inner ear compartment. It is the one which is attaching in our inner ear compartment. Okay. So you have got this stapes out. Stapes has got a head, a neck, an anterior crura, posterior crus, foot plate, and it is attaching to the inner ear compartment. Okay. Now, what exactly is this got to do? Anything which is above the foot plate, this is called as suprastructure of stapes. This is called as suprastructure of stapes, which is above the foot plate. Okay. The stapes attaches to the inner ear by its foot plate, and it also has got a ligament there. And that ligament which attaches this foot plate through the inner ear, this is called as annular ligament. This is called as annular ligament. Now, this is just to tell you exactly what is the development like. So, don't get scared. We are going to do much in detail about it. But just remember, there is something called as suprastructure of stapes. Then it has got a foot plate, and then it has got a ligament around it, which is called as an annular ligament, which is attaching it to the inner ear. Okay? To the part of the inner ear, which is called as a vestibule. Okay? Or the oval window. Now, the suprastructure of the stapes is derived from the condensation of the mesenchymal cells of second arch. If malleus of incus was from first arch, the suprastructure of the stapes is from second arch. So if I call suprastructure of stapes is a derivative of which arch? It is a derivative of the second pharyngeal arch. When I say malleus and incus, they are the derivatives of first pharyngeal arch mesenchymal cells or the mesoderm. Are we getting that? Okay. Now what is remaining? The foot plate of the stapes is remaining. The annular ligament is remaining. This particular area develops from otic capsule. Now I'm not going to go into otic capsule because this otic capsule concept I'm going to give you in the inner ear part. Okay, but just remember as of now that otic capsule is the one which gives its development to the foot plate of the stapes and the annular ligament, and the suprastructure of the stapes is deriving itself from the second arch mesoderm or the mesenchymal cells. Okay, this finishes our development of the middle ear. And I hope you guys have understood about how this first arch and second arch are actually developing from, or what is developing from what arch. Okay, many small tiny questions come in this particular segment. Fine. Now we'll go on to understanding a lot of things. Okay, and I want you all to memorize and imagine at the same time. Now here I'm going to show you where exactly is your middle ear. What are you actually reading about? And I need to show you very conceptually as to what your middle ear is. Okay, so what I want you guys to do, I want you all to remember the skull that was there in your first year. Okay, that skull you had, right? When you remove the calvaria, so what I'm doing is I'm going to remove my calvaria, the topmost portion of my skull. I've removed the brain and I'm now looking from the top. I'm now looking from the top inside my skull, right? And I'm going to draw different areas of my base of skull. Okay? Smaranya, otic capsule is actually, otic capsule I'm going to teach you properly in your inner ear part. Okay, so don't worry about it. It will come in otic it will come in the inner ear development. Okay, but just remember that the otic capsule is there, which is forming the annular ligament and the stapes foot plate. Okay, right. Now, I'm going to make the base of skull for you, and I want you all to make that base of skull with me. Okay, so create that image of what is the base of skull. Then we are going to read the ear properly. Now, I am looking inside your skull after removing the brain. Now, how does it look like? This is your huge skull. Okay. These are the two ears outside. And this is the nose. This is the nose, right? Okay, so you're looking inside my skull. And how does that look like? Now, there are various bones which are there in your skull base, right? We are going to make all those bones and we are going to revise those bones, which you have already read. Now, you have got a very important bone here in the front, which is what? This is your orbital part of frontal bone. Now, remember, see, this is your orbit, right? The superior part of the orbit. It is formed by frontal bone. So, this all plate is called as what? This is called as orbital part of frontal bone. Now, you will ask me, why am I doing that? It's for your own good. You'll understand half of ear on this diagram. Orbital part of frontal bone. Okay. Now, in the center over here, there is a small part of our ethmoid bone. There is a small part of ethmoid bone, which has got a lot of foramen over it. Now, can anyone tell me what exactly is this structure which is present in the center above our nose? Can anyone tell me that? What exactly is this structure that I have drawn in the center above our nose? It is a part of our ethmoid bone. Any one of that? Right? So, this particular area which is present, this is a cribriform plate. Absolutely, Soumyadeep. So, that's a great answer. So, this is cribriform plate, which has got many of these foramina. So, this is our cribriform plate. This is our cribriform plate. Okay, this is the anterior part. And many of these olfactory neurons come through this cribriform plate into the brain. Okay? Okay. Now, this is the crista galli, what I have drawn there. Smaranya, it's right. So basically, this is the Krista Galli. Anant Krishnan, that's a great answer. Okay, now one very important bone comes down which looks like Batman. Which looks like Batman. And this bone which comes down, which looks like Batman, this is the lesser wing of sphenoid. This is the lesser wing of sphenoid bone. Lesser wing of sphenoid bone. Okay. And it has got these two processes over here. It has got these two projections over here. And these are called as anterior clinoid process. Okay. This is going to take some efforts, but I'm going to make sure that you understand all of these very well. Okay. So you've got this anterior clinoid process over there. Okay. Right. Now, next comes, you have got two more projections over here. Okay. And then comes a way down a structure. Now, this is called as, if this is anterior clinoid process, this particular area is called as posterior clinoid process. Called as posterior clinoid process. And you have got a fossa in between here where your pituitary gland sits. Okay. This fossa. This is your hypophyseal fossa, or we also call it the pituitary fossa. Okay. This is the hypophyseal or the pituitary fossa. And this is the posterior clinoid process, which comes down with a projection. And this projection here is called as clivus. It is called as clivus. Okay. We are still understanding what is the base of the skull anatomy like. And these are the very important structures to make you oriented to anatomy of middle ear. Okay. So we are making, still we are not there in the middle ear till now. Chalo. Now, there is a very important foramen which is present just behind the clivus here. This is what? This is a very big foramen and we call it foramen magnum. This is called as foramen magnum. Right? Okay. Now comes the main part where your middle ear and inner ear is. This was the time we were waiting for. Now make two triangles like this. Make two triangles like this. What are these triangles? What are these triangular bones, which I can also say they are the densest bone of the human body. They are the dense bone. They are very, very hard. That's not easy to crack this bone. So what exactly is this bone all about? This triangular bone. Now this triangular bone forms a part of our temporal bone, and this part is called as petrous bone. This is the petrous temporal bone. This is the petrous temporal bone. Yahi bone hai which is the maximum important as far as middle ear is concerned. The inner ear is concerned. So this is the petrous part of temporal bone, or we can also call them as simply petrous pyramids. Okay. So your temporal bone, if I talk about, has got different parts. It's got a squamous part which is flat. Squama means flat. This is the squamous part of the temporal bone. Okay. Then you have got another part of the temporal bone which is behind your ear. This is the mastoid part of the temporal bone, right? Then you have got one part inside which your external auditory canal is present, which is called as the tympanic part of the temporal bone. When you go inside into the ear, then that has got these petrous pyramids, which is the next part of the temporal bone called the petrous part of temporal bone. And some authors also regard styloid process as a part of our temporal bone. So these are the parts of our temporal bone, and I am going to singularly focus on in this lecture on this part, because the petrous part of temporal bone has our box. It has our box, which is our middle ear box inside it. Okay, the petrous part of the temporal bone is the one which contains this middle ear compartment or the tympanic cavity. Okay, and medial to this is our inner ear. Medial to this is our inner ear anteriorly, which has got cochlea. It has got cochlea anteriorly. And then there are these semicircular canals which are present over like this. There is the cochlea which is present anteriorly. Then you have got these semicircular canals which are 3 in number, which are present like this. Okay. So this is medial to the middle ear. External ear is lateral to the middle ear. And what exactly is the middle ear? It is a cavity. It is actually a cavity. So that means this middle ear is like an empty house. Suppose I'm standing inside a house. It is one empty house. So if I drill this petrous part of temporal bone, I'll enter inside into the middle ear cavity. That is why we call it as a tympanic cavity, because it is like a cavity which contains a lot of things. Okay. So I told you what? I told you that your temporal bone has got important parts. squamous part, mastoid part, tympanic part, and then the petrous part. Sometimes styloid is also part of our temporal bone by some authors. Some authors don't believe it. Okay? Inside your petrous part of the temporal bone, you have got the middle ear cavity, which is present towards the base of the petrous pyramid, and medial to it, there is your inner ear compartment, which we are going to read later on. Okay? So these are what the importance of these structures is when they are present, and this is how the orientation is when you look at the middle ear from the top. Right? And you can simply think of that this middle ear is like a box. It has got an anterior end, it has got a posterior end, it has got a lateral end, it has got a medial end, it has got a roof which is towards you, and it has got a floor which is present down or below, which I cannot see. Correct? So these are how the walls of the middle ear is. That's how we conceptualize this concept on the basis of that we are standing inside a room, and this is the same room I'm talking about, which has got this anterior wall, posterior wall, medial wall, lateral wall, up and down. And we're going to see all of them later on. Right? Okay? So this is what the middle ear is all about. Now let me just take you inside this middle ear, how it actually looks like. Now let me just take you. So what I'm going to do is, I'm going to go inside this tympanic cavity. I'm going to go inside this temporal bone. Now when I go inside this temporal bone, something comes up like this. Now see, this is what? This is how I've entered inside from the top, inside my petrous part of temporal bone, and I'm seeing this beautiful cavity over here. This is called as the tympanic cavity, or I simply call it the middle ear cavity. Are we getting some kind of a logic behind things, right? You can see here, this is the external ear, because this is your tympanic membrane here. This is the external part of the ear. This is the medial part of the ear. When I go here, I'll go into the inner ear. And this center part, this is our middle ear, or the middle ear cavity. Okay, fine. So this is how exactly our middle ear looks like. Now this doesn't look like a box. This doesn't look like that six-sided box that we read, right? When you read up your textbooks, right? Very common textbooks are followed everywhere. And when you open that textbook, you will always see one huge box wala diagram. And that box wala diagram is not actually in real life, the middle ear looks like a box. It's actually looking like something, a biconcave structure. It looks like a biconcave structure, right? So it's not the box that we read. We make that box in order to make things easier for us, or conceptualize how the middle ear is. So now let me show you how exactly is your middle ear actually. We have gone inside into the tympanic cavity now. Okay. And now we are going to see how the middle ear looks like. Okay. Now how exactly is the middle ear? Again, I want you to draw this diagram with me. So you have seen the middle ear from the top. Now I want you all to see the middle ear from the side. Okay. And when you see from the side, I'm going to cut my head in a sagittal plane. That means I'm going to cut my head in this direction. And now when I cut it like this, you're going to see the ear from the side. And you're going to conceptualize as to what exactly it is. Okay. So now, if we read the ear from the side or in a sagittal section, I've got an external auditory canal. That is the superior end. That is the inferior end. Okay. This is the external auditory canal. Right. Now, the external auditory canal, superior part, it has got a projection. It has got a projection. Now see, you see this projection? So it has got a projection before the tympanic cavity starts. It has got a projection over here, the superior part of my external auditory canal. I'm going to tell you later on what this is. Okay. Now, this whole of your ear will now be like a biconcave disc that I already told you. So your whole of the middle ear will look like what? The whole of the middle ear will actually look like a biconcave box. So your whole of the middle ear has got biconcavity. Okay, it's not like a six-sided box. We are going to read it later, but it's actually biconcave, this whole of your middle ear. Okay, or your tympanic cavity. We're making the tympanic cavity, and it actually looks like this. Okay, now this is your middle ear, this is your external auditory canal, and inside, medial to the middle ear, is your inner ear. Correct? So what are the parts of your inner ear? Let me just put it over here. You've got the cochlea, right? You've got the vestibule, and you have got semicircular canals. One is posterior semicircular canal, one is superior semicircular canal, and one is lateral semicircular canal. These are the three semicircular canals which are present. Okay. So you've got cochlea, you have got a central chamber called as vestibule, and there are these three semicircular canals which are present. We're going to deal later on in the inner ear anatomy. What are these canals? What is vestibule? What is cochlea? Don't worry about them. But just remember, this is our inner ear side. This is the middle ear, this is the external ear. Okay? Now, at the junction of the external auditory canal and the middle ear, what is present? There is a very important structure that is present, that is our tympanic membrane. So our tympanic membrane is the one which is separating our middle ear from our external ear. And this is how our tympanic membrane looks like. Okay? So tympanic membrane is actually present in here, right? And how many parts are there in the tympanic membrane? So there are two parts of our tympanic membrane. The topmost part of the tympanic membrane is called as what? It's called as pars flaccida. We call it pars flaccida for a reason, because it is very, very flaccid. Flaccid means, you know, it moves very easily. Okay? It's flaccid, like floppy. Then there is a tense part of our, very tense part of our tympanic membrane, and this is called as pars tensa. This is called as pars tensa. Okay? So, no, this is not a coronal section. This is, see, this is what, this is you're seeing from the side. Imagine you're seeing from the side. Coronal is like this. When I cut it like this, then it is coronal. Okay? This is something in a sagittal section, where you're seeing things from the side. I've cut my ear like this, and you're seeing something from the side. Okay? Right? Okay? So, now you've got an inner ear compartment, you've got a middle ear compartment, as well as you've got an external ear compartment. Okay? Now comes the next part. Next part is that when there is a pars tensa, there is a pars flaccida. So let me just put it over here. There is a pars flaccida. There is a pars flaccida, and there is a pars tensa. There is a pars tensa. There is a pars tensa, there is a pars flaccida. Okay? Right? Okay, I think there are sections which are not clearly understood. Okay, so see, I'm making things simple for you. See, don't get confused when I say sagittal section. Sagittal section means that you're viewing from the side. Okay, you're viewing from the side. But if you cut my head like this, correct, my external auditory canal will go like this. My inner ear will be there. My middle ear compartment will be there. So whatever you are seeing here, this is a partial coronal cut with a sagittal cut. Because there are some structures which you cannot see in a coronal cut like cochlea like this. Okay? So you can simply imagine I've cut myself like this, but you're viewing it from the side. Okay? Because some of the structures won't be visible when I purely view it from the side. You can call it a coronal cut. It's okay. You can call it a coronal cut. You've got external, you've got the middle, you've got the inner ear. Okay? Fine. So now you've got the pars flaccida, you've got the pars tensa. Okay? And this is the pars flaccida, this is the pars tensa. The same. Now comes a very important part. Now I'll put the middle ear ossicles. We'll put the middle ear ossicles. Middle ear ossicles are what? You have got malleus, incus, and stapes. That means you have got the malleus, which is pehla, first ossicle. That is malleus, which has got a head, which has got a lateral process, and which attaches here to the pars tensa. So this is how your malleus is. And malleus attaches to the pars tensa. Okay? Now comes your incus. This is your incus. Okay? This is the body of the incus. This is the short process of incus. And then comes down the long process of incus. And then it opens on to the stapes. Okay, this is your stapes. Let me just make it a little more proper here. Let a little bit bigger. So this is your incus. Okay? And it comes down with the long process. This is the long process of incus, and this is the stapes, which is opening in your inner ear compartment. Okay, so far so good. Now we have got these three ossicles, okay? But now this whole tympanic cavity has to be divided into three segments. That is what? We have got the epitympanum, we have got mesotympanum, and we have got hypotympanum. So there are three cavities this particular middle ear has, which is called as epitympanum, mesotympanum, as well as hypotympanum. That means my whole of the middle ear, the tympanum, that means what? The tympanic cavity is divided into three segments. That is the epitympanum, that means epi means above, mesotympanum, that means in the middle or the center part, and hypotympanum, that is the lowermost part of the middle ear cavity. Now, how can I identify this? What is epitympanum, what is mesotympanum, and what is hypotympanum? Okay, we need to draw some imaginary lines. Okay, now, if I draw an imaginary line from the lower end of my pars tensa, anything below it will be my hypotympanum. So if I draw an imaginary line from where my pars tensa is ending below and I go behind, anything below that is called as what? Hypo. Hypo means below. Tympanum. Tympanum means middle ear. Okay? If I draw another imaginary line from where my pars flaccida has ended. See, this is the red point, which is the pars flaccida has ended, right? So with the end point of my pars flaccida, or I can say the start point of my pars flaccida and the junction between my pars tensa and flaccida. The junction between my pars tensa and flaccida. This junction. I can call that, right? This portion, if I draw an imaginary line, I go back and I cut this and I go through the lateral process of the malleus behind. Anything between them is called as mesotympanum. So what exactly is mesotympanum? Mesotympanum means if I draw an imaginary line from the point between the junction of my pars tensa and the pars flaccida, and that line goes beyond and crosses the lateral process of the malleus and then goes behind up till the superior end of the promontory. Can you see that? Up till the superior end of my promontory. This line and the below line, anything between that is my mesotympanum. Okay, this chamber here is my mesotympanum. Okay, fine. Okay, so this is my mesotympanum. And then comes a chamber which is above this line, and this is called as epitympanum. ये ऊपर का chamber is called as epitympanum, or we can simply call this chamber as attic. Attic का मतलब होता है roof. The uppermost part which is called as the roof of the middle ear. Okay, fine. So ये important चीज है that the whole tympanic cavity is divided into three segments. A topmost portion which is called as epitympanum, a center portion which is called as mesotympanum, and a lower portion which is called as hypotympanum. If I draw an imaginary line from the lower end of the pars tensa behind, that area below will be my hypotympanum. If I draw another imaginary line at the junction of the pars tensa and the flaccida, which crosses the lateral process of the malleus and goes behind, anything between them is the mesotympanum. And the structure which is present above this line, this is called as epitympanum, or the attic, or the topmost part. Are we understanding? Right? Now, okay, mesotympanum. Mesotympanum is the area, okay, Smaranya, you can see that. Mesotympanum is the area which is center. Meso means middle. Okay, so you can simply say the part of the middle ear which is behind the pars tensa. This is the part pars tensa, right? So anything behind the pars tensa is my mesotympanum. If I just remove this pars tensa on a whole, I'll enter inside my mesotympanum. If I remove this pars flaccida on a whole, I'll enter into epitympanum. Okay, and I can't see hypotympanum. Why? Because it is below the pars tensa. Okay, so if I draw two imaginary lines, one from the lower end of the pars tensa, one from the upper end of the pars tensa, anything below, in between them is our mesotympanum. Okay, so now these are the three segments of the middle ear, and very importantly, these three segments will be read in all our diseases. Okay, fine. So we are clear here. What are the three segments of the middle ear cavity? Epi, meso, and hypo. Epi is also given the name as attic. Okay, chalo. Now, if you see, I told you that your superior end of the external auditory canal is actually dipping down. There's a sharp projection of this bone, right? And this projection of the bone, I can also say this is my lateral attic wall. Correct? If you simply say this is the lateral side, right? So I can say this bone is my lateral side of the attic, or I can also say it as lateral attic wall. So there is a fancy name given to this structure which is called as scutum. See, this is lateral. This is medial. So this wall, this projection which is produced by the external auditory canal, superior wall, is given the name as my lateral attic wall because this is lateral to the attic, right? So this is my lateral attic wall, and we also call it as scutum. Scutum, or lateral attic wall, in simple words. Very important when we read cholesteatoma, this particular wall. Okay, right? So this is what the whole idea about the middle ear cavity all about. अब हम लोगों ने ये इसको middle ear cavity को एक biconcave box की तरह बनाया, right? So what exactly are the dimensions of it? The epitympanum, that means this area, is around about 6 millimeters. ये पूरा area is around about 6 millimeters. Then it gets compressed in the center, in the middle. This area is around about 4 millimeters. That means the mesotympanum is around 4 millimeters. And it expands again below. And this hypotympanum is what? Oh, sorry. This is 2 millimeters. And 6 minus 2, this is 4 millimeters. Okay? Okay? So the broadest part is above, that is epitympanum, that is 6 millimeters. Then it narrows down. You can see it narrows down. This is 2 millimeters. And then it expands again, which is the hypotympanum, and that is 4 millimeters. So 6 minus 2, you can read it as 4. Okay? The vertical dimension or the vertical height of the middle ear is around about 15 millimeters. Is around about 15 millimeters. Okay? So it becomes 6, 2, and 4. 6 above, 2 in the center, 4 below. Okay? So these are the dimensions of the epitympanum, mesotympanum, hypotympanum, and the vertical height of the middle ear. In simple words. Okay? Mirza, you didn't get lateral attic wall. I'll just explain you simply. See, lateral attic wall means कि ये जो superior canal है, the superior wall of the external aortic canal is actually dipping down. It's dipping down. You can see that this shelf-like projection that is present, this projection is present lateral to our attic. ये attic है. This is the epitympanum. This bone is present lateral to it. So this bone is called as lateral attic wall. अगर ये हम बोलेंगे, this is medial attic wall. This is lateral attic wall. Right? Because this is lateral side. This is medial side. So this lateral attic wall is the other name for that is scutum. It's a very important bone which gets very normally eroded in a condition called as cholesteatoma. और हम बाद में ये condition पढ़ेंगे. Right? That's called as an unsafe ear. Now let me ask you one simple question. If I ask you, which is the most dangerous part of our tympanic cavity? Is it the epitympanum, mesotympanum, or hypotympanum? इसमें सबसे dangerous कौन है? What is the most dangerous among all of them? Anyone? Which area is the most dangerous? Okay. No, not the hypo. Think, why will be there hypo? Hypo has nothing. Hypo has nothing. Everything is there in the epitympanum. All my heads of the ossicle, malleus, head of my incus, short process of my incus, everything is there importantly in the epitympanum. That is why any disease of the ear which involves the epitympanum or the attic will be called as unsafe disease. Or we simply call them as unsafe ear disease or unsafe ears. Okay? तो हम बहुत commonly ये condition पढ़ते हैं. तो anything which is in epitympanum, ये problem आएगी. There will be a problem in the epitympanum. There will be an issue that the heads of the ossicles will get involved. यहीं पे इसके पीछे facial nerve जाती है. We'll read about facial nerve later on. But the facial nerve will get involved. So ये सबसे important segment है ear का. Okay? Right. चलो. So we have understood some parts about what is the tympanic cavity all about. अब जब हम लोग पढ़ ही लिया है, तो we'll go into that. Now see the same. This is the upper end, right? So let me just draw an imaginary line from the lateral process behind. This is our epitympanum, right? From the lower end, just let me draw behind. This is our hypotympanum, और ये center का part is mesotympanum. Now can you visualize? The same thing that I drew there. This is the same structure that we have understood. Right? The epi, the meso and the hypo. अभी तक हमें यही समझ में आया कि ये parts क्या हैं. Right? अब now we will go into understanding जो middle ear का actual concept होता है. That is the six-sided box जो आप पढ़ते हैं. Right? And we are going to create a diagram and some kind of a concept about वो six side का box कैसे बना. तो अब ये box, the same box, we are going to expand out that box and we are going to read it in the form of a wall. Okay, we are going to read in the form of a wall. तो अगर ऐसे पढ़ते हैं, तो I told you that this is the middle ear, right? And it has got various walls. जैसे मैं एक रूम में खड़ा हूं, right? I'm standing inside a room. I've got various walls. एक wall मेरे सामने है, that is my anterior wall. एक wall मेरे पीछे है, that is my posterior wall. एक wall मेरे ऊपर है, that is my roof. एक wall मेरे नीचे है, that is the floor. एक wall मेरे medial है, that is the medial wall. एक wall मेरे lateral है, that is the lateral wall. So that makes a six-sided box concept of the middle ear. Or always I call it the mystery box. Why? Because this mystery box is going to be the major question in your professional papers. If you give your third year paper, right, you will be having this long answer as to make a diagram and explain the structures of this six-sided box. तो व्हाट इज दिस बॉक्स कॉन्सेप्ट, और ये होता क्या है? तो सबसे पहले हम लोग एक बॉक्स बना लेते हैं, एंड आई वांट यू ऑल टू मेक अ बॉक्स विद मी, एंड दिस बॉक्स यू हैव टू इमेजिन ऑल द स्ट्रक्चर्स अकॉर्डिंग टू दिस बॉक्स. So now I have taken that tympanic cavity and I have kept you here. ठीक है? And when I kept this tympanic cavity, now I have a huge box. I've got a huge box. Okay? We'll make this box. Okay? So let's make a huge box. Okay? So this makes our box into a six-sided box. और मैंने किया क्या है? What you are seeing inside through this box, ये मेरी medial wall है. This is my medial wall of the middle ear, जो आप अंदर देख रहे हो, right? तो ये medial wall आप कब देखेंगे? When will you see this medial wall? जब इस पूरे box का दरवाजा खुलेगा, or the door of this box will open. So now I am going to open the door of that box. Correct? I'm going to open the door of that box. So now I have opened the door of this box. I'm opened the door of this box. ठीक है? Are you understanding that now I have opened the huge door of that box and now you're seeing inside the middle ear cavity. Okay? Now what you're seeing inside, अगर ये open मैंने किया है तो this is my lateral. So this is my lateral wall. अगर मैंने open किया, this is my lateral wall which I have opened. This is my lateral wall which I have opened. So when I have opened the lateral wall, what wall you are seeing inside? This center is the medial wall. This is my medial wall. Okay? What you're seeing inside? Right? Now, this has to be anterior. This has to be posterior. So this is my anterior wall. So simply I'll call this particular wall as anterior wall. Okay? This is posterior to me. So I'll call it what? Anterior, and this is posterior. So ये वाली wall मेरी कौन सी wall हो गई? This is my posterior wall. This is my posterior wall. Okay? ये ऊपर है तो I'll call it the roof. And ये नीचे है, I'll call it the floor. Okay. So this becomes 6 walls. Right? ठीक है? Now, we are going to go into each and every wall separately. कि कौन सी wall में क्या होता है. Okay? And we are going to see what all structures are present inside which wall, क्योंकि ये बहुत important है. Let's start from the roof. पहले roof और floor खत्म करते हैं. अब you only think my middle ear is inside, right? What is there above my middle ear? What is there above my middle ear? Think from that perspective which I drew. Think from this perspective. इस middle ear के ऊपर क्या है? What is there above it? What is there above the roof? Anyone of you wants to try that? इसके ऊपर, imagine what is there. Yes, it's exactly the brain. Right? It's a temporal lobe. The brain is sitting over there. This is a temporal lobe. It is sitting over there, right? So the temporal lobe is sitting over this petrous part of temporal bone. ऊपर है ये. So that means there is a part or a piece of a bone which is separating my middle ear cavity from the brain. Correct? My middle ear cavity from the brain. Now let me show you that. So there is your temporal lobe of the brain above. There is temporal lobe of the brain above. This is your temporal lobe. Okay, this is your temporal lobe. And it is covered by meninges. So you have got meninges over it. Okay. So that means the roof is basically demarcating my middle ear cavity from the temporal lobe. Or I can say this temporal lobe is present inside my middle cranial fossa. Correct? So that means the middle cranial fossa, which has got this temporal lobe, is the one, this particular roof is demarcating that. That means the roof is segregating my brain from the middle ear cavity. Okay? So we call it by a name. We call this area or the roof by a name. And the other name for the roof of the middle ear is called as tegmen. It is called as tegmen. It's also called as tegmen. Okay? So this is called as tegmen or the roof of the middle ear, which is separating my temporal lobe from the middle ear cavity. Now the roof of the middle ear is basically a contribution of two parts of temporal bone. That means this roof is formed by contributions of two parts of my temporal bone. One part is the squamous part of temporal bone, and the other part is basically the petrous part of our temporal bone. So there is a suture that is present in between them, and this is called as petrosquamous squamous suture, called as petrosquamous suture. Okay, so the roof basically is a contribution, or it is contributed from two bones, which is our part of our squamous part of temporal bone, part of our petrous part of temporal bone, and there is a small suture in between them that's called as the petrosquamous suture. Okay, now many of the times this petrosquamous suture might be patent, it might be open. So that might be the reason why children develop intracranial infections when any middle ear cavity infection happens. Okay, so there can be an infection in the middle ear, and that can travel through this patent petrosquamous suture, and it can go inside and can, cause an intracranial abscess. Okay, so this is a very important part that you should remember. This patent petrosquamous suture could be an important issue for traveling or infection into the brain. Now, because this is tegmen, so we also call it tegmen tympani, very rightly said, Lubhit. So this is tegmen tympani. So tegmen tympani is basically why it is called tympani, because tympanum is middle ear. So the other name is tegmen tympani. You can also call it simply tegmen, or you can simply call it the roof. Okay, so now we have done the roof. We have done one wall. Everyone is clear about what is the roof, right? Chalo. Now once we have done about Swaranya, I think we have already done that, right? The roof separates the middle ear from the brain. It is made up of contributions of two bones. Squamous part of temporal bone, petrous part of temporal bone has a petrosquamous suture in between, right? And this also is called as tegmen. You can also give it a name as tegmen tympani. Tympani means middle ear. Okay? Chalo. Now we have done the roof. Now let's go to the second wall, which is the floor. नीचे कर लेते हैं. अब ऐसे सोचो, middle ear अंदर है, right? तो floor नीचे होगी, right? The floor will be below. अब there is a very important sinus. अब I want you all to imagine that sinus. आपकी occipital protuberance पीछे है. This is your occiput, right? यहीं से दो साइनस आते हैं, which are called as transverse sinus. Just like my mic over here, there are two sinus which are coming out laterally, which are called as transverse sinus. Okay, transverse sinus. Transverse sinus बनते हैं sigmoid sinus. They continue down as sigmoid sinus, जो हमारे mastoid में run करता है. It runs down in our mastoid. That is called as sigmoid sinus, right? Sigmoid sinus then takes a kind of a bulge or a loop. See, it comes down like this sigmoid, and then it makes a loop, and this loop or a bulge is present at the floor of the middle ear, and then it comes down of the jugular foramen to form the internal jugular vein. So basically the internal jugular vein is a continuation of our sigmoid sinus. In simple words, तो क्या बोला मैंने? Sigmoid sinus is coming down, and this sigmoid sinus is turning above. It's a little bit turning, and this turn forms a loop. It forms a bulb. It forms a kind of a projection at the floor of the middle ear. And then it comes out of the jugular foramen to form the internal jugular vein. So basically हुआ क्या? Let me just show it to you over here. There is your sigmoid sinus. There's your sigmoid sinus. And then that sigmoid sinus basically forms a kind of a bulge. It forms a bulge at the floor of your middle ear. Okay, it forms a bulge at the floor of your middle ear compartment. And this bulge that is created by the sigmoid sinus at the floor of your middle ear compartment, this is called as jugular bulb. This is called as jugular bulb. Okay, and later this jugular bulb continues as the internal jugular vein over in your neck. Okay, so sigmoid sinus का ही continuation हमारी internal jugular vein है. We need to understand that. तो ये हमारा हो गया जुगुलर बल्ब. ओके, तो अगर मैं आपको बोलूं कि आपकी फ्लोर किस चीज को सेपरेट कर रही है, द फ्लोर इज सेपरेटिंग आवर मिडिल ईयर कैविटी फ्रॉम द जुगुलर बल्ब. करेक्ट, राइट? तो इस वॉल को या इस फ्लोर को हम लोग जुगुलर फ्लोर भी कह सकते हैं या जुगुलर वॉल भी कह सकते हैं. व्हाई? बिकॉज दिस इज द पार्ट विच सेपरेट्स आवर मिडिल ईयर कैविटी फ्रॉम द जुगुलर बल्ब, which is a continuation of our sigmoid sinus. अब इसकी प्रॉब्लम क्या है? In many of the children, when they are born, this floor might be absent. जिसको बोलते हैं हम anatomical term में dehiscent. अगर एक bone properly form नहीं होती है, we call that bone as dehiscence or dehiscent, right? So this floor might be absent. तो उन children में जिसमें ये floor बनी नहीं होगी या this floor will be absent, उनमें ये jugular bulb middle ear cavity के अंदर आ जाएगा. उनमें ये बल्ब मिडिल ईयर कैविटी के अंदर आ जाएगा ऐसे. एंड वी कॉल दिस एज अ हाई जुगुलर बल्ब. हाई जुगुलर बल्ब का मतलब कि नाउ द फ्लोर इज एब्सेंट एंड एक्सीडेंटली द जुगुलर बल्ब हैज नाउ बीन प्रोजेक्टेड इनटू द मिडिल ईयर कैविटी, राइट? एंड दिस इज वन ऑफ द रीजन why it can cause an injury or accidental injury in this jugular bulb can happen during certain procedures such as myringoplasty, such as myringotomy. ये स्ट्रक्चर ये बेसिकली ऑपरेशन होते हैं जो हम लोग मिडिल ईयर में करते हैं, और एक्सीडेंटली अगर ये हाई जुगुलर बल्ब मिल गया एंड इफ इट गेट्स इंजर्ड इट विल लीड टू टोरेंशियल हैमरेज. इट विल लीड टू टोरेंशियल हैमरेज या फिर इट विल लीड टू अ लॉट ऑफ ब्लीडिंग. Okay, so basically what has happened, some children, this floor might be absent or it might be dehiscent. Whenever this floor is absent or it is dehiscent, this bulb can actually project out into the middle ear cavity. When it projects out into the middle ear cavity, then that case we will call it as a high riding jugular bulb or a high jugular bulb, which can accidentally get injured, and this accidental injury can lead to torrential hemorrhage or it will lead to lot of blood. Okay, so we need to be very careful in children and we need to see कि उनकी dehiscent नहीं है floor. Their floor is not dehiscent. That is a very important part that we need to understand. Okay, this is about the floor. Now, let me just remove this high jugular bulb. And now, this floor also has got one opening. Okay, there is one opening in the floor. Now, most of your textbooks don't give this, but just remember there is another opening in your floor. This opening that is present in your floor, this is called as inferior tympanic canaliculus. This is called as inferior tympanic canaliculus. या छोटा सा फोरामेन होता है या छोटा सा होल होता है. We call that an inferior tympanic canaliculus. Now what is this inferior tympanic canaliculus? Canaliculus मतलब कैनाल, छोटी सी कैनाल, राइट? ये छोटी सी कैनाल होती है. तो इससे एक स्ट्रक्चर पास होता है into the middle ear. There's a very important structure that passes through this canal into the middle ear. And that nerve which passes through this inferior tympanic canaliculus into the middle ear, this is our glossopharyngeal nerve or the ninth nerve. The ninth nerve or the glossopharyngeal nerve. So the part where the glossopharyngeal nerve enters into the middle ear cavity occurs through this inferior tympanic canaliculus. And this ninth nerve which enters inside into the middle ear has got a name to it, very, very important name. And this is called as Jacobson's nerve. This is called as Jacobson's nerve. Okay, this is called as Jacobson's nerve. So what is Jacobson's nerve? Jacobson's nerve is a part of our glossopharyngeal nerve which supplies our tympanic cavity or which goes inside our middle ear cavity. Okay, great. So now we have understood about what is the Jacobson's nerve. Okay, that has entered into the middle ear cavity. So now we have finished what is the roof. We have finished what is the floor. Now, is there any doubt on the roof or the floor? Anyone has got any doubt about what is the roof? What is the floor? Okay, anything that you need to say? Okay, I'm trying as much Hindi as possible. Okay, so that all of you can understand. सब लोगों को समझ में आए. I'm trying it in both ways ताकि आप सबको ये चीज समझ में आए. Okay, तो अब हमने दो चीजें कर ली. We have done the floor और हमने roof कर ली. और ये एक इंपॉर्टेंट नर्व आई है अंदर, that is called as the Jacobson's nerve. ठीक है, चलो, वेरी गुड. इफ इट्स क्लियर देन दैट मींस नाउ आई कैन गो. अब हम लोग करते हैं एंटीरियर वॉल एंड पोस्टीरियर वॉल पहले, ठीक है, फिर हम लोग बाद में करेंगे मीडियल एंड लैटरल. नाउ वी गो ऑन टू एंटीरियर वॉल. ठीक है, अब नाउ लेट मी गो बैक टू द सेम डायग्राम आई ड्रू फॉर यू. दिस डायग्राम. अब दिस इज एंटीरियर, यानी ये चीज एंटीरियर है, राइट? नाउ यहीं पे देयर इज अ कैनाल. देयर इज अ कैनाल दैट इज प्रेजेंट इन द एंटीरियर वॉल. And this canal is basically called as the carotid canal. मतलब internal carotid artery actually आएगी अंदर, right? So internal carotid artery comes out through this canal and this is called as carotid canal. That means अगर हम anteriorly देखें middle ear से, so what is present anteriorly? It is our internal carotid artery that is coming out through this carotid canal. Correct? Swaranya, yes, normally bulging नहीं रहती है because there is a floor. It's not there. Normally it's not bulging. If it is absent, then it is bulging. Okay, so this is called as a carotid canal. So the internal carotid artery is coming out through this canal, right? अब यही चीज मैं वहां पे बनाऊंगा, anterior to the anterior wall, what I drew for you. तो यानी कि यहां पे इसके आगे there is an important artery which is present. And what is this artery? This is our internal carotid artery. This is our internal carotid artery. ठीक है, we have understood that. Anterior to the middle ear is internal carotid artery. Now, इंटरनल कैरोटिड आर्टरी के अराउंड एक प्लेक्सस होता है. देयर इज अ प्लेक्सस ऑफ नर्व्स अराउंड द इंटरनल कैरोटिड आर्टरी, राइट? एंड दिस प्लेक्सस ऑफ नर्व्स आर बेसिकली सिंपैथेटिक. दे आर सिंपैथेटिक नर्व्स. sympathetic nerves, okay, which are present basically around it as a loop around the internal carotid artery. Okay, ab what are the structures that open in the anterior wall of middle ear? You need to say two openings are there, TT, ET. ऊपर है TT, नीचे है ET. So what is the two openings in the anterior wall of the middle ear? ऊपर वाली को बोलेंगे TT, नीचे वाली को बोलेंगे ET. Now what is the TT and ET? TT means canal of tensor tympani muscle. तो ये वाली जो कैनाल होती है, we call it as canal of tensor tympani. Now tensor tympani is a muscle. ये एक मसल होती है that enters inside the ear, the middle ear. Okay, तो ये कैनाल होती है that is called as tensor tympani. Tympani means middle ear. Tensor मतलब ये tense करेगी. अब क्या tense करेगी? I'll tell you later. So this is a canal for tensor tympani जो इस मसल को entry देता है. And below that is your ET. ET मतलब this is the eustachian tube opening. This is the opening for our eustachian tube. Eustachian tube. Okay? अब eustachian tube हमें पता है उसके दो एंड होते हैं, राइट? क्या एंड होते हैं eustachian tube के? एक एंड होता है जो हमारा मिडिल ईयर में खुलता है, and the other end of the eustachian tube opens in our nasopharynx. It opens in our nasopharynx. That is present behind the nose. Okay? So this is called as pharyngeal end of eustachian tube क्योंकि ये pharynx में खुलता है, nasopharynx में, and this is called as tympanic end of eustachian tube which opens in the anterior wall of the middle ear. Okay, so TT above, ET below. These are the two openings. Now there is one more opening here. ये आपके books में normally नहीं देते हैं, but you have to remember there is another opening. और उस opening में basically क्या होता है कि this opening is called as canal of Hughier. Canal of Hughier. That's another opening that is present above the opening of the tensor tympani. Okay? So what is the importance of this canal of Hughier? This is the canal through which a very important nerve exits the middle ear. मतलब वो middle ear के अंदर एक nerve है that exits out through this canal of Hughier. And this nerve which exits out, I'm going to tell you later on what is the course of this nerve, but this nerve that exits out, this is called as the chorda tympani. It's called as chorda tympani. So what is chorda tympani? Chorda tympani is actually a branch of our facial nerve which is present inside the middle ear, and it is given as a branch. And chorda tympani is the nerve of taste. हमें जो taste देती है, that is chorda tympani. It supplies the anterior 2/3 of the tongue. Anterior 2/3 of the tongue, all the taste जो भी आप खाते हैं, छोले भटूरे, बर्गर, जो भी हम खाते हैं, the taste goes by chorda tympani. और ये chorda tympani is going to exit out of the middle ear cavity once it has been given by the facial nerve through this canal which is called as canal of Hughier. This is a very important point क्योंकि ये question बहुत commonly आया है NEET PG में, that what exactly passes through the canal of Hughier. The answer will be chorda tympani which is present around the anterior wall of the middle ear. ठीक है, तो ये हो गया anterior wall के बारे में. Is everybody clear about the anterior wall? Roof, floor, anterior wall done. तो 6 में से 3 walls are complete. Okay? Everybody has finished? Right? What is this anterior wall? 3 walls are finished. Chalo. Great. Now we'll move on to the next wall. अब हम next wall पे आते हैं. And now we'll finish off the lateral wall. Lateral medial करते हैं. Last में we will do the posterior wall. So now I told you कि lateral wall क्या होगी. Now you only try to think about कि lateral wall क्या होगी. What will be the lateral wall of my middle ear? Laterally क्या है मेरे middle ear के? What is covering my middle ear? क्या है मेरे lateral middle ear के lateral? What is there? क्या है मेरे lateral? Anyone? Tympanic membrane. Absolutely, Soumyadeep. It's absolutely right. बिल्कुल ठीक. So we have got the answer. If we see here, ये हमारा lateral है. This is lateral. So lateral क्या है? What is there? It is the tympanic membrane. Correct? Which is bridging the gap between external ear and the middle ear cavity. तो similarly जब मैंने ये door open किया आपके लिए, तो यहां पे आपको क्या मिलेगा? You have got the tympanic membrane. You have got the same tympanic membrane which has got a pars flaccida, a pars tensa, and the ossicles which are attached to it. तो malleus है, incus है, right? Stapes नहीं है, but वो मैंने हटा दिए. But malleus, incus ये सब ये आपने खोल दिया लेके, right? The same thing. Open the door. This is your lateral wall. Okay? Fine? चलो, तो lateral wall is also given the other name as इसे हम मेम्ब्रेनस वॉल भी कहते हैं. वी ऑल्सो कॉल इट मेम्ब्रेनस वॉल. ओके, why? Because it contains tympanic membrane. Similarly, the anterior wall is also called as carotid wall, क्योंकि यहां पे carotid artery होती है. Is also called as carotid wall, right? And this is your membranous wall or the lateral wall. Okay, fine. Chalo, we have done the lateral wall also now. Now we are left with two important walls. एक wall जो हमें lateral wall खोल के we are seeing inside and we are seeing the middle ear cavity, correct? And we have got one posterior wall. Two walls are left. Now what is the medial wall all about? अब हम ये देखते हैं. Now remember, I told you in the beginning कि अगर मीडियल वॉल पे हम देखें, दिस इज लैटरल, दिस इज मीडियल, तो मीडियल वॉल में, मीडियल टू द मीडियल वॉल, दैट मींस मीडियल वॉल के पीछे व्हाट इज देयर? इट इज आवर कॉक्लिया एज वेल एज द सेमी सर्कुलर कैनाल्स. करेक्ट? अब two structures are actually producing significant bulge in this cavity, in this tympanic cavity. यानी दो ऐसे स्ट्रक्चर है इनर ईयर के which are actually producing a bulge in the middle ear cavity. Okay, now what are those structures which are producing a bulge in the middle ear cavity? एक तो you can see this. One structure is here, which is the cochlea, correct? And one structure is here, which is my lateral semicircular canal. If you simply think, मेरी lateral semicircular canal is like this. Right? It's coming out. It's coming out like this. It's coming out like this, right? So it's producing a bulge in my medial wall of the middle ear. Okay, fine. So there are two important bulges which are there in your medial wall of the middle ear. One is produced by the lateral semicircular canal and one is produced by the cochlea. Okay, so ये cochlea, this cochlea will produce a bulge in the medial wall of the middle ear, and this bulge that is produced here, this is called as promontory. This is called as promontory. So what is the bulge of the middle ear that is produced by the cochlea called as? Or the turns of the cochlea produce a bulge in the middle ear. What is that? It is promontory. यानी सेंटर में एक बहुत बढ़िया bulge आती है that you can see in every person, and this bulge is called as promontory. It's called as promontory. Okay? और अगर if we see very simply here कि promontory पे there is one structure going over the promontory. What is this structure going over the promontory? You have this ninth nerve or the Jacobson's nerve. Right? The Jacobson's nerve is actually going to the promontory. Now imagine, glossopharyngeal nerve is a parasympathetic, will carry parasympathetic fibers. It is going to carry parasympathetic fibers. So parasympathetic fibers are never alone. They have to have their sympathetic counterpart. Parasympathetic कभी अकेले नहीं हो सकते. They have to have sympathetic with them. Correct? तो वो sympathetic nerve कहां से आएंगी? I told you in the beginning, these are the sympathetic nerves which are present around the internal carotid artery. So these nerves which are present around this internal carotid artery are also going to travel inside into the middle ear, and the sympathetic as well as the parasympathetic nerves which are coming from the Jacobson's nerve or the glossopharyngeal nerve, they are going to form a kind of a plexus. They're going to form a plexus. Plexus matlab web. Guchha. That plexus is given the name as what? It's called as tympanic plexus. It's called as tympanic plexus. So agar hum suppose, let me just note it down over here, that agar hum medial wall पढ़ रहे हैं, so in the medial wall of the middle ear, one structure that we have read is promontory, right? That is produced by the bulge of cochlea. एक और प्लेक्सस बना है उस प्रोमोन्ट्री के ऊपर, उसका कंट्रीब्यूशन है फ्रॉम द सिंपैथेटिक नर्व्स ऑफ द इंटरनल कैरोटिड आर्टरी एज वेल एज फ्रॉम द पैरासिम्पैथेटिक ब्रांचेस ऑफ द ग्लॉसोफेरेंजियल नर्व, राइट? सो they both are going to form this plexus, that is tympanic plexus. So those structure we have read. Okay, yes Soumyadeep, sympathetic nerves are going to pierce the anterior wall and come in, but that piercing is so small that they don't produce a very significant opening. Tabhi I didn't tell you as a separate opening that is present for the carotico-tympanic nerves. Okay, but yes, they pierce the anterior wall and come in. Okay, so अब हमें मिल गया tympanic plexus. Tympanic plexus has got what? It has got parasympathetic fibers and sympathetic fibers. Sympathetic fibers are coming from the carotid artery, internal carotid artery, right? So हम लोग इसको एक और नाम दे सकते हैं. We can give it a name there. So these nerves are also called as carotico-tympanic nerve. In simple verbs, yeah, carotico-tympanic nerves. Why? Because this is carotic and tympanic. So carotico-tympanic, right? Nothing but it's a fancy name because it is involving two structures. And these are the sympathetic nerves. Okay, many one word questions will come out from here. Many one word questions. So that's why I'm going a little slow over here. Chalo. So now we have made two structures on the medial wall. Promontory, over that is the tympanic plexus. Now, I told you that there is another structure which is producing a significant bulge over on the medial wall of middle ear. And that is what? That is a canal over here like this. That is a lateral semicircular canal. So, एक और canal है. That semicircular canal it is producing a bulge. And that bulge is by our lateral semicircular canal. So, this is our lateral semicircular canal bulge. Okay, the lateral semicircular canal bulge. So, let me just write it down over here that the third structure that you see over on the medial wall of middle ear, that will be what? That is your bulge of lateral semicircular canal. Okay, so we have read about three important structures that are present on the medial wall of the middle ear. ठीक है, चलो वापस चलते हैं. अब now you have to remember two windows. One window is present posterior superior to the promontory. Posterior superior, this is posterior. So one window is present posteriorly and superiorly to the promontory, and one window is present posterior inferior to the promontory. एक विंडो posterior superior है promontory के, एक विंडो posterior inferior है promontory के. Two windows we need to learn, right? Now what are these? Posterior superior to the promontory, there is one window which is elliptical, or we can say it is oval. और ये oval होती है, तभी इसका नाम भी हम क्या देते हैं? It is called as oval window, क्योंकि ये oval होती है. So we call this particular part as oval window, which is present posterior superior to the promontory. There is an opening, okay? And there is another opening which is present posterior inferior to the promontory, और ये round होती है, इसीलिए हम इसको कहते हैं round window. तो एक oval होती है, एक round होती है. तो एक oval window, एक round window, right? So we have got two structures or two windows, one present posterior superior, which is called as oval window, which is a little elliptical or oval, and the other one which is present is called as round window, which is present posterior inferior to the promontory. Okay, this much is clear. अब oval window पे क्या खुलता है? What opens over the oval window is my question. What opens over the oval window? I told you in the beginning. I told you when I started. What is one structure that opens over the oval window? Yes, right. That's absolutely right. That's what? It is our stapes. The third part or the third ossicle that is present over our inner ear, right? Correct part. Right, Soumyadeep. So it is stapes, right? So the stapes is actually sitting over our oval window. This is our stapes, which is sitting over our oval window. Correct? Right? The stapes footplate. Absolutely right. That's the correct, that I would say is the correct way to answer. The stapes nahi, stapes ki footplate. Very good. Anand Krishnan. That's absolutely right. So footplate of the stapes is opening over on the oval window. Okay? Now, this is the part of the oval window. I'll leave it here. Okay? अब इसी से ही whenever the stapes will move, it will conduct the sound through the oval window into the inner ear. So when we read about physiology, we are actually going to read that, how the sound is conducted. But the stapes will move over the oval window and it will conduct the sound into the inner ear compartment. Okay? अब हम लोग आते हैं राउंड विंडो पे. राउंड विंडो राउंड होती है, but actually ये थोड़ी सी डिफरेंट है. Round window has got two pillars of bone around it. It has got two pillars of bone around it. यानी राउंड विंडो एक दो पिलर से ढकी हुई है. It has got two pillars around it. Okay, that means it is actually like a pillar over here. एक पिलर ये है, एक पिलर ये है, और इसके पीछे ये राउंड विंडो है. There's a round window behind these two pillars. Now, these pillars are called as posterior pillar towards the posterior side and anterior pillar towards the anterior side. And this whole arrangement is given the name as round window niche. This whole arrangement is called as round window niche. Okay? It's called as the round window niche. So round window niche kya hai? Round window niche is actually a ledge of bone which has got this anterior pillar and posterior pillar, jiske andar round window hai, which contains the round window inside. Okay, so if I want to look inside into the round window, I'll have to actually remove the niche and then I'll be able to see this round window that is present inside it or within it. Okay, and this niche is formed by an anterior pillar and a posterior pillar. There are two pillars which this thing is forming. Okay. Now, round window is covered by what? Round window khuli nahi rehti. Like stapes foot plate is covering our oval window, round window is also covered by something. And the covering of the round window is called as secondary tympanic membrane. The covering of the round window is called as secondary tympanic membrane. It's called as secondary tympanic membrane. Okay, remember that. This is a question which has been asked. What is the covering of the round window called as? It's secondary tympanic membrane. Okay. Chalo, so far so good. Now we have done about some structures related to the oval window and the round window, lateral semicircular canal. We have done the promontory, we have done the tympanic plexus. चलो अब हम नेक्स्ट आते हैं. अब एक चीज आई वॉन्ट टू इंट्रोड्यूस हियर विच इज अ पार्ट ऑफ आर पोस्टीरियर वॉल. तो कंफ्यूज मत करना, दिस इज अ पार्ट ऑफ आर पोस्टीरियर वॉल, बट इन ऑर्डर टू अंडरस्टैंड द मीडियल वॉल वी नीड दिस स्ट्रक्चर. तो एक स्ट्रक्चर होता है प्रेजेंट ऑन आर पोस्टीरियर वॉल एंड दिस एक्चुअली लुक्स लाइक अ पिरामिड. इट एक्चुअली लुक्स लाइक अ पिरामिड क्योंकि ये ट्रायंगुलर स्ट्रक्चर है, तो ये पिरामिड की तरह दिखता है, राइट? बट ये होता पोस्टीरियर वॉल में. It is present in our posterior wall. There's a triangular projection present in our posterior wall, and this is called as pyramid. So I'm just writing it a P here. It's called as pyramid. It's present in our posterior wall. Now, one thing which is very important is that there is a projection of bone which begins from the lateral end of the promontory and it goes towards the pyramid. So there is a bone which goes from the lateral end of the promontory and comes towards the pyramid. What is this bone called as? This bone is called as ponticulus. This bone is called as ponticulus. So let me just mention it here. This is called as ponticulus. So what is ponticulus? Ponticulus is a ridge of bone, or basically it is a bone which is coming out from the lateral end of the promontory and it is going towards the pyramid. This is called as ponticulus. Okay, fine. Now I'll tell you another ridge of bone, very important bone. This ridge of bone starts from the posterior pillar and it goes towards the posterior wall. See this. It starts from the posterior pillar and goes towards the posterior wall of the middle ear, right? This ridge of bone that is present over here, this is called as subiculum. This is called as subiculum. Okay. So I told you two names over here. Let me just go and write them out. I've told you there is one ridge of bone, एक bone है, that is coming out from the lateral end of the promontory and it is going up till the pyramid. और इस bone को मैंने बोला ponticulus. Ponticulus. That means it is starting from the lateral end of the promontory and it is going up till a projection in the posterior part of middle ear, that is a pyramid. इसे मैंने बोला ponticulus. एक और ridge of bone है, that is called as subiculum, which is starting from the posterior pillar of the round window and it is going up till the posterior wall of middle ear. और इसे मैंने बोला subiculum. तो दो ridge of bone निकले, एक ponticulus जो ऊपर है, एक subiculum जो नीचे है. Okay, so these are the two bones that we have read till now. Okay, now very important thing that I'm going to tell you. इनके बीच में स्पेस दिख रही है, which is having ponticulus above and subiculum below. We call this tiny little space in the middle ear as sinus tympani. We call this particular area as sinus tympani. Sinus matlab space. Tympanum matlab middle ear. So a space which is present, or a potential tiny space which is present between the ponticulus above and the subiculum below, is called as sinus tympani. So this particular small area is sinus tympani. Let me just write it down over here. This is our sinus tympani. Okay? Are we clear on what is sinus tympani? Are we clear on what is ponticulus? What is subiculum? What is this space all about? Very, very important space. Okay? So this is one space which is a hidden space of middle ear. It is a hidden space. ये छुपी रहती है. And this hidden space of the middle ear is the one which carries a lot of importance in a disease called as cholesteatoma. Cholesteatoma एक disease होती है जो बहुत commonly इस space में घुस जाती है. It hides in this space. And when it hides in this space, then it creates, when we are dealing with surgical, whenever we are taking out the disease from the middle ear, तो जब भी हम disease निकालते हैं, हम sinus tympani में disease छूट जाती है. We usually leave out the disease in sinus tympani accidentally because this space is very, very small. And maximum cases of recurrence of disease happen in sinus tympani because this space is so small that the disease is usually left out. But we try. There are various ways in which we clear the disease from sinus tympani also. वो अभी नहीं जाएंगे. But there are various ways in which a surgeon chooses how to clear the disease from this tiny space because it is so small. Okay. So is everyone there with me? Have we done about the sinus tympani? Have you understood what is ponticulus? What is subiculum? What is this sinus tympani all about? Okay. So this completes one more of your part on the medial wall of middle ear, and that is what? That is your sinus tympani. तो हमने अब 8 चीजें कर ली हैं, राइट? 8 चीजें कर ली हैं. Okay, sinus tympani is the space between the ponticulus above and the subiculum below. Okay, we have done 8 things now. Now let me move on to the last 2 things that you need to remember is as far as this particular medial wall is concerned. Medial wall में बहुत चीजें हैं. So that is why we are going very very slow with it. अब आते हैं हम 9th चीज पे. What is the 9th thing? Now I want you all to write a C. I want you all to write a C over the promontory. Okay, एक C लिख दो promontory पे. So this is like a hook-like projection. ये hook की तरह है, right? It looks like a hook-like projection. So this hook-like projection, which is present anterosuperior to the promontory, is given a name, and we call this particular name or hook-like projection, which is present anterosuperior to the promontory, as processus cochleariformis. So now let me write it down. There is another thing that you have read now, 9th, that is processus. मतलब ये छोटा सा process है. Cochleariformis, which is nothing but it is a hook-like projection. It is a hook-like projection. ठीक है? This is a hook-like projection. एक hook की तरह होता है. Okay? So this projection up here, this is your this particular projection. This is your processus cochleariformis. Now, what exactly the importance of processus cochleariformis holds? ये है क्या? What exactly it holds? There is a very important canal that I told you in the anterior wall, which is your tensor tympani, the canal for tensor tympani, correct? तो ये canal for tensor tympani से एक muscle आएगी, कौन सी मैंने बताई थी? That is your tensor tympani muscle. Is going to come inside through this canal, and once it comes inside through this canal, it's going to hook around. It's going to hook around this processus cochleariformis, and it goes and attaches to the neck of the malleus behind. That means imagine ऐसे करो that my pen is the neck of malleus, that my pen is the malleus. Let's say my pen is the malleus. So this actual muscle is coming through this tensor tympani canal. It is hooking around this processus cochleariformis, and it is going and attaching to the neck of my malleus behind. It is going and attaching to the neck of my malleus behind. Okay. So what is this muscle going to do? अब ऐसे सोचो. Have you ever gone to a very loud space, right? और आपने ये देखा होगा suddenly बहुत सारे loud sounds enter करते हैं. आप पार्टी में अब the DJ is playing a lot of songs, right? And बहुत songs loud हैं. But every one of you don't get deaf, right? None of you don't get deaf, right? आप वापस आते हैं. You don't get deaf. Why? It's because of the magic created by this nerve, this particular muscle. So tensor tympani क्या करती है? The moment a loud sound enters into the ear, this particular muscle contracts. And when this will contract, it will pull the malleus away from the incus. That means it won't allow that sound to go inside. Rather, it will pull it away from the stapes, so that the loud sound doesn't enter inside into the inner ear compartment. And that is why we call this as the dampener of sound. We also call it as a dampener of sound. Very nice. You guys are already telling it, right? So dampener of the sound. ये dampen करता है. That's why this muscle is so important. It saves you from noise trauma. Okay, fine. So far, so good. We have entered into the last part of the middle ear, medial wall of middle ear. That is the last part that you see. And that is what? That is the facial nerve. So facial nerve ही बची है. That is the 10th thing that you will see. I told you 10 things are seen over on this particular aspect, the medial wall of the middle ear, importantly. And the last part that you will see is the facial nerve. A facial nerve जो है, that's a huge thing. We're going to read a lot about facial nerve diagrammatically. हम लोग बनाएंगे facial nerve. But let's say the facial nerve is coming from the brain. Okay? And facial nerve, what happens is, it comes and it turns. When it comes from the brain, it turns. It turns at the superior wall. Superior and medial wall, the junction between them, it turns. And it runs horizontally. at the superior end of the medial wall. It is running horizontally at the superior end of the medial wall. You're seeing that? It's running horizontally at the superior end of the medial wall after it has turned. After it has turned. And then what happens is this facial nerve turns again. It turns again, but now it turns between the lateral semicircular canal and the oval window. See? It turns between the lateral semicircular canal and the oval window, and it passes down behind the pyramid out through a foramen which is called as stylomastoid foramen. So stylomastoid foramen matlab ye facial nerve aise aa rahi hai. It's coming down like this inside my mastoid. Right? It's coming down here. And it's coming out of a foramen which is present between my styloid as well as mastoid. That's called as stylomastoid foramen. बस अभी के लिए इतना याद रखना that there is a foramen called as stylomastoid foramen through which the facial nerve is exiting. So what I told you was कि facial nerve आ रही है brain से. It is coming to the middle ear and then it is turning. Now this turn is called as a genu. It's called as genu. G-E-N-U. Called as a genu. Genu का literal meaning क्या होता है? Genu का क्या मतलब है? What do you mean by genu? Genu का मतलब होता है bent knee. It is known as a bent knee. मतलब genu का मतलब होता है कि अगर आपने अपने knee देखी है ना, this looks like a knee, like a bent knee. So this turn also looks like a bent knee. सब कोई बैठा हुआ है. That is why it's also called as first genu. So first genu of the facial nerve actually is at the junction between the roof and the middle wall and the medial wall of the middle ear. फिर क्या हो जाती है? ये horizontal हो जाती है. And this horizontal facial nerve runs along the roof of the middle ear. That means you can see that medial wall की upper side पे it is running like this. It's running at the upper end of the medial wall. Correct? And then it is turning and it is taking another bend. And this second bend is called as second genu. This is called as second genu. That means facial nerve has got two genus or two turns. One is first and one is second. Now this is turning and it is coming between the oval window and the lateral semicircular canal. And now it is coming to form a vertical segment. और ये vertical segment pyramid के पीछे it is running vertically down. Vertical मतलब सीधा. It is coming down and it is exiting out of the stylomastoid foramen. So in simple words, I can say that the medial wall of the middle ear has got which segment of the facial nerve? The horizontal segment of the facial nerve. The transverse segment of the facial nerve या horizontal segment of the facial nerve. Correct? ये वाली wall पे horizontal या basically we can say a tympanic segment of the facial nerve. So there are three names to it. The transverse you can call it horizontal segment of facial nerve, you can call it tympanic segment of facial nerve. Any of the three is related to the medial wall of the middle ear. Right? So you can say that what is the 10th part that we read is that my facial nerve horizontal part, or I can also say transverse part, or I can also call it tympanic part, is actually running at the upper end of my medial wall. Is actually running at the upper end of my medial wall, which I just told you. Right? Correct? So these are the 10 things that are present over on the medial wall of the middle ear. And I hope you guys have understood about what the medial wall has to offer you. Or what is this medial wall of the middle ear all about. Okay? I hope you guys have understood that. So is there any question till now before we move on to the final wall of the middle ear? Posterior wall. Okay? So I hope you guys are understanding. So is everything clear about till this roof, floor, anterior wall, lateral wall and medial wall? Okay? Great. So now if you guys have understood, we are going to move forward. And now we are going to start thinking about what has to be on the posterior wall. And posterior wall, I've already told you one important structure. That is what? That is a triangular bone which is present on the posterior wall of middle ear. And that is your pyramid. That is pyramid. Correct? मतलब ये pyramid एक projection की तरह एक triangle की तरह है. That is present there. Now, this pyramid gives origin to one very important muscle. This pyramid has got an origin of a very important muscle, and this muscle is going to attach to the neck of the stapes. Okay? So there is a muscle which originates from this pyramid and it goes and inserts onto the neck of the stapes. Now this muscle has also got the same function as that of the tensor tympani. मतलब अगर ये contract करेगी, so it will dampen the sound, and we call this muscle because it is attaching onto the stapes, we call this particular muscle as stapedius muscle. We call this particular muscle as stapedius muscle. So let me just write down the posterior wall here. Posterior wall में we have read an important structure that is called as pyramid, which is a triangular projection which is present there. And there is a muscle which is arising from the pyramid and attaching to the neck of the stapes, and we called it as a stapedius muscle. दो हमने structure पढ़ लिए that are present over on the posterior wall. Okay? And stapedius also is a dampener of sound. ये भी जब contract करेगी, it will dampen the sounds. Okay? चलो. Now, what else is present on the posterior wall? You can see one more structure which is running behind the pyramid. ये क्या है? What is running behind the pyramid? What is the third structure that is present over on the posterior wall of the middle ear? Please tell me, what exactly can you see? It's a vertical segment of the facial nerve, which is running on the posterior wall. Correct? So the vertical segment of the facial nerve is our next thing that we will see over on the posterior wall of the middle ear. Correct? So the vertical facial or vertical part of seventh nerve or the facial nerve is something that you will see on the posterior wall running. Correct? Okay? Very right. So now we have read about the third part also, that this is our vertical segment of the facial nerve which is running in the posterior wall. Okay? Now let's come to one more important structure, one more important nerve, I can say. Now this nerve is given off as a branch of facial nerve. That is facial nerve होती है ना, तो facial nerve की एक branch होती है which is actually given off as a sensory branch. You can say it is supplying our anterior 2/3 of the tongue, right? And I told you that there is this nerve here. What is this nerve? This is our chorda tympani. Okay? So this chorda tympani is coming from where? I told you the exit, but I have to tell you the entry. So chorda tympani is a branch of seventh nerve which actually comes out from the vertical segment of the facial nerve. Then it goes and runs between the malleus and the incus, and then it exits out from the canal of Eustachian. मतलब ऐसे है कि अगर इस बॉक्स को आप क्लोज कर देंगे तो your ossicles will go inside, right? Your ossicles will come inside. So this chorda tympani is coming out from the vertical segment of the facial nerve. Then वो malleus and long process of the incus के बीच में से जा रही है, and it is exiting out from the canal of Eustachian to supply the anterior 2/3 of the tongue. Are we imagining that? Are we getting that imagination? Are we guys understanding that? What exactly is this particular chorda tympani like? Okay? I'll tell you stapedius. Okay, so I'll tell you stapedius. But can you understand what is the chorda tympani, what I told you? Okay? So basically क्या हो रहा है? That this nerve is there, it's coming out from the vertical facial. And from the vertical facial, आप ये दरवाजा बंद कर दो, close this door. It's running between the malleus and the incus and then exiting out of the canal of Eustachian to supply the anterior 2/3 of the tongue for taste. Okay? So I can say that this chorda tympani is a branch of vertical segment of the facial nerve. Correct? Now, when this chorda tympani is given off from the vertical segment of facial nerve, it basically has got an entrance point. जैसे ये exit point है, इसकी canal होती है जिससे ये enter करती है into the ear. And this canal through which this particular nerve enters into the middle ear, this canal is called as posterior canaliculus. Canaliculus मतलब canal. मतलब जब ये facial इसको बनाती है, that means when the facial vertical part gives off the chorda tympani enters into the middle ear through an opening that's called as posterior canaliculus. Okay? Then once it comes out of the posterior canaliculus, close this door. This chorda tympani will run between the handle of the malleus. It will run, let's say this is the handle of the malleus, this is incus. So it will run between my handle of the malleus and the incus. And then it will go into this canal of Eustachian and exit out to supply the anterior 2/3 of the tongue. Okay, some kind of imagination you need to come up with. Okay, because this is something which is difficult to explain you. But imagine this is a closed door. I've opened it up, that's why the ossicles have gone there to show you. Okay, so are we clear on this chorda tympani? The opening where it comes into the middle ear, that is called as posterior canaliculus. That's also a question for you. That's also a question. Okay, chalo. Now we have understood about what exactly is the posterior canaliculus, that is the entry point of chorda tympani, and what is the canal of Eustachian, which is the exit point of chorda tympani. ठीक है? Up. Can you see a space between here? Can you see this little space? This little triangle? That means a space which is having vertical segment of the facial nerve medially and the chorda tympani laterally. This space is called as facial recess. This is called as facial recess. So what is facial recess? Facial recess is a potential space that is present between the vertical segment of the facial nerve medially as well as the chorda tympani laterally. Okay, and this is going to be a potential space that's called as facial recess. So I told you two important spaces. One important space is the sinus tympani, which is present between the ponticulus above and the subiculum below. And the other one is called as your facial recess, which is present between the vertical segment of the facial nerve medially and the chorda tympani laterally. This is the facial recess. Okay, so are we understanding the concepts behind what is this? What exactly is the funda behind what is the facial recess and what is sinus tympani? Both these spaces are very important for hidden diseases in the middle ear. यहीं पे ही सारी की सारी diseases hide करती हैं. They hide behind in these compartments or छोटू compartments of the middle ear. Okay, and this is what the two important spaces are all about. So we are just going to write down what else was present on the posterior wall. We read about the posterior canaliculus. And we read about the facial recess. Right? Posterior canaliculus was actually the entry point of the chorda tympani. Okay, fine. So far, so good. Now we have understood about what exactly is these parts. Now let's go to the final part of posterior wall. Imagine posterior to the ear. Posterior to the ear is which bone? Now let me go back to this side. This diagram. See, this is the posterior wall, right? This is the posterior wall. What is there behind the posterior wall? What is this bone? What is there behind the posterior wall? What is this bone? This is which bone? This is our mastoid. So posterior to the posterior wall, there is another wall or there is another bone which is connecting, which is our mastoid bone. Correct? Right? Facial recess, you want to learn again, Smaranya. Facial recess is a space which is bounded by vertical segment of the facial nerve medially as well as the chorda tympani laterally. See, chorda is lateral, facial is medial. So between them, there's got a small space called as facial recess. Okay. So you've got mastoid, right? You've got mastoid. Now let me just imagine that mastoid is behind here somewhere. Mastoid is behind here. Mastoid is behind here. Let me just imagine. Now the mastoid has got many air cells. Mastoid में बहुत सारे air cell होते हैं. But the largest air cell of the mastoid is called as mastoid antrum. Antrum का मतलब होता है largest air cell of mastoid. सबसे बड़ा air cell of mastoid क्या है? It is mastoid antrum. Okay. Now, one very important thing you need to understand. ये mastoid है, posterior है to the middle ear, but how will this mastoid be connected to the ear? How will it be connected? There has to be some channel, right? So there is a channel. There is a channel, and that channel basically is the one which connects our upper part of the ear, or we can say the epitympanum, to this antrum. So our upper part of the ear or the epitympanum is connected to this particular tympanic cavity. Right? So there is, let me just draw it again. There is a channel. So see this, there is a channel which is connecting the upper part of my middle ear or the epitympanum or the attic to my antrum. Right? And this bone or a channel which connects my epitympanum or the attic to my antrum, this little bone over here, this is called as additus. This is called as additus. So if I ask you, what is additus? Additus is a bone or it is a small bony channel which is connecting my attic. Attic means the upper part, the epitympanum that I told you. It is basically connecting my attic, the epitympanum, to the antrum or the mastoid air cell system. ये छोटी सी bone is called as additus. Okay? So this is another opening that is present over there. I can say that the next part we can see in the posterior wall is the additus. Oof. This is all about the sixth wall concept that we drew about. I want you all to finally imagine what we dealt. The huge story behind this mystery box. So ये mystery box है. This is a challenge that you have uncovered of this mystery box. And I hope this mystery box is now in your hand. I hope now you can easily visualize what is where in the middle ear. और क्या क्या structure होते हैं, क्या क्या चीजें होती हैं, right? I hope you guys have mastered this middle ear concept. but kahani is still left. I'm still left with some kahani, okay, about the lining part, about the blood supply as well as the muscles, okay. So just hold on, we are going to go into, ab humne ghar bana liya hai. We have done the whole wall, we have done the house, okay. Now we have to keep structures inside it. Now we have to put things inside it. और वो inside क्या है, जैसे हम लोग रहते हैं, the members of the house, they are the structures present inside our middle ear cavity. Right? Okay? So now we are going to deal with what are the structures of the middle ear. Okay? Now, when I say what are the structures in the middle ear, before that I need you to understand what is the concept of middle ear cleft. What is this middle ear cleft all about? Now, what is this middle ear cleft? Middle ear cleft is one thing which your examiners or which whenever you're going for a viva or what exactly the people will ask you is what is the middle ear cleft? Cleft kya hota hai? Whenever I'm talking about the middle ear cleft, that means I'm talking about the whole of the middle ear. Mesotympanum, hypotympanum, attic or epitympanum, additus, antrum with the mastoid air cells together with the eustachian tube. Yani ki if there is any disease which happens in my middle ear compartment, it can go through my additus into the mastoid. Right? Eustachian tube will be responsible for getting any disease into the middle ear. That means anything crossly can go from one place to another place. Tabhi, whenever we read ear, whenever we read middle ear, we read the ear in the form of a cleft together. And we call them as middle ear cleft structures. So that means the whole of the middle ear, epitympanum, mesotympanum, hypotympanum, additus, antrum, mastoid air cells, eustachian tube, they all form together a middle ear cleft. Okay? So I hope you guys have understood about this box concept. If everything is clear, I think we can go forward and we can start up with making what are the people living inside the house. Okay? Fine? Chalo. Now let's go on to something easy because now the difficult parts of middle ear is over. We have discussed much in detail about what is the difficulty level. Okay, what are the difficult parts of the middle ear. But now the things are very, very easy. अब हम लोगों को अंदर बैठाएंगे. We are going to read about what exactly are the contents of our middle ear compartment. So contents of our middle ear is obviously they have got ossicles, we have got blood vessels, we have got nerve vessels, we have got, what do you say? The muscles, okay? I know it's too saturated parts, but let me tell you, see, the best part of our life lies on the other side of our fear. This is something which was said of by Will Smith. There is nothing called as saturation in medical science. Remember that. COVID-19 was not a chapter of microbiology till it was the biggest disease in the world because things never saturate. We have to understand this today in order to master things tomorrow, right? If we have to read about chronic otitis media, if we have to read about, we have to read all these things properly. That's why I say anatomy has to be here, anatomy has to be here, so that diseases become less. It won't go away, it won't come in a day, but you have to be very sure about what you are reading today. So if you put that much effort today, then your efforts will turn up to be very fruitful tomorrow. That's how it is. That's how, especially that is for ENT. I've not gone into head and neck, which is more complex, but we have to try. We have to try building it up, right? Rome was not built in a day. धीरे धीरे करके बनाएंगे, right? That's how medical science is. धीरे धीरे बनती है. That brick you have to place one by one. Okay. Ossicles of middle ear आसान है. 3 ossicle होती हैं. Malleus, incus, stapes. Right? पहली ossicle हो गई malleus. अब malleus में क्या क्या होता है? What are the parts of the malleus? इसका देखो ये head हो गया. This is the head of the malleus, right? Then what do you have? You have got a process which is coming out like this. This is called as lateral process of malleus. Okay, this is called as lateral process of malleus. You have got another process which is coming out anteriorly. This is called as anterior process of malleus. And then you have got one huge thing which comes down, and this is the one which attaches to the tympanic membrane, and this is called as handle or manubrium. This is called as handle or manubrium. Okay, so you've got head, you have got neck, you have got lateral process, anterior process and handle or manubrium. ये handle की तरह दिखता है. अब अगर इसको देखें तो ये कैसा दिखेगा? How do you actually look like? It actually looks like a hammer. It actually looks like a hammer. तो हम इसे hammer भी बोलते थे. We simply used to call it hammer. Okay. Anant Krishna, I'll tell you in the end why that confusion is there. I'm going to tell you later on, but just complete it first. Okay. So hammer भी बोलते हैं. So you've got this looking like a hammer. अब ये किससे जुड़ता है? Where will it get attached to? It will get attached with incus. Okay, it will get attached with incus. This is our incus. It will get attached with incus. Now, you've got the malleus over here. You've got the malleus over here. Okay, and it is attaching to the incus, right? अब incus कैसी दिखती है? Incus looks like an anvil. Incus looks like an anvil. Anvil का मतलब क्या होता है? Have you seen big, the iron beaters? वो iron rod को ना पटक पटक के मारते हैं over a slab, that iron slab. That is what is called as an anvil, right? And that is how the incus looks like. It looks like an anvil. Okay? So anvil has got what? Anvil has got a body. It's got a body. It's got a small projection which is called as short process or short crus. It has got a long process या long crus. और इसकी छोटी सी प्रोसेस होती है जो स्टेपी से जुड़ती है, एंड दैट इज कॉल्ड एज लेंटिक्यूलर प्रोसेस. ओके, तो क्या क्या पार्ट हो गए इंकस के? you've got the body, you've got the short process, long process, and a small process which is called as lenticular process. Okay, that's called as lenticular process, right? Okay, now this is lenticular process. This is the one which will attach to the stapes. Yani below that will be the stapes. Okay, so now let me get in the stapes. See, this is your stapes. So over on the head of the stapes, my lenticular process of the incus will attach. इसी के ऊपर आके ऐसे बैठ जाएगी. Correct? So that is what is the incus going to attach to. It is going to attach to this head of the stapes. Now I told you in the beginning, stapes has got what? इसके ऊपर का पार्ट होता है head, जिसको हम लोग दूसरी वर्ड में कहते हैं capitulum. It's called as the head of the stapes or capitulum. ठीक है? छोटी सी इसकी पार्ट होती है which is called as neck, and then it has got these two projections. They are called as crus. इसमें दो crus होते हैं, एक anterior एक posterior. So one is called as anterior crus, one is called as posterior crus. दो crus हो गए, head हो गया, neck हो गया. We have already done that in the embryology section, right? And then it comes down over a foot plate. So you can call this as the foot plate of the stapes, which sits over our oval window. That is what I told you there. तभी देखो ये oval है. It's looking like an oval or it looks like an elliptical, right? So ये हो गई आपकी oval window. अब between the anterior as well as the posterior crus, right? There is a small foramen over here, right? There's a small foramen. This is called as obturator foramen. This is called as obturator foramen. Okay? Right? So this is what exactly is the whole idea about these three ossicles. So now let me show you in real life ये दिखती कैसी हैं. It's very, very small. And see, this is how beautifully the ossicles actually look like in real life. You've got these three ossicles. This is your malleus, head of the malleus, neck of the malleus, lateral process of malleus, handle of malleus. Right? Then you have got this incus, body of incus, short process of incus, long process of incus, and then small lenticular process of incus. Attaching to head of stapes, neck of stapes, then there are these two crura, anterior and posterior, and this is a foot plate. And this foramen center, this is the obturator foramen. Okay, fine. अब आता हूं मैं NEET question पे. Now, why am I doing this topic in so much sincerity with you, and I'm, teaching you with everything what is there inside? It's because I'll tell you what is the level of NEET questions they have asked. In NEET PG papers, they will ask you, what is the type of joint present between the malleus and incus? Now see how much depth they have gone in asking. They are not going to leave you in asking about, they will ask you, okay, tell me about promontory. They will ask you, what is the joint like? वो आपसे पूछेंगे anterior canaliculus, canal of Hughes. These are the questions they will ask you. That is why depth is important when we read ENT. Because there will be few questions, but they will be very tough questions. So what is this joint between the incus and malleus? This is called as incudo-malleal joint. This is called as incudo-malleal joint. And this is a type of saddle variety of joint. This is a saddle joint or a saddle variety of joint. Right, Parth? Absolutely right. That's a saddle joint. Bonus point. Okay? So that's a difficult question. That's a saddle joint. अब ये कौन सा होता है? Can anyone tell me? Can anyone try? What is this incudostapedial joint variety? What is that? This is a basic joint which is called as ball and socket joint. तो incus और stapes के बीच में होता है ball and socket joint. दोनों joint question है. Ball and socket. Correct, Soumyadeep. That's ball and socket. Okay? Correct. I think all of you are right. Many of you are answering that. Great. So I think You guys are great. You guys have got a lot of knowledge already. Okay, ये हम already पढ़ चुके हैं. This is we have already read in detail कि दो मसल होती हैं मिडिल ईयर में. कौन सी मसल होती हैं? अच्छा, this is also a question. One is stapedius and the other one is tensor tympani, and we have already known about this. But what I have not told you is कि इनकी nerve supply क्या होती है. This is also a question to you कि nerve supply stapedius की क्या है, nerve supply tensor tympani की क्या है. Both these muscles come in the middle ear, पर इन दोनों की nerve supply different है. ये important है. Okay, so the nerve supply to stapedius is from the nerve of stapedius. Nerve of stapedius. And this nerve of stapedius is a branch of facial nerve. It's a branch of facial nerve. So facial nerve is giving off nerve of stapedius, and that is supplying our stapedius muscle. Question number 1 asked many times in your NEET PG. But what they have asked recently is कि tensor tympani की क्या nerve supply है. So the tensor tympani is supplied by V3 division of trigeminal nerve. Trigeminal nerve के 3 पार्ट होते हैं, V1, V2, V3. V1 ophthalmic, V2 maxillary, V3 mandibular. Mandibular division or the V3 division of this mandibular division of the trigeminal nerve or the fifth nerve is the one which gives off the supply to tensor tympani muscle. Remember that. Okay, and stapedius is supplied by facial nerve. ठीक है? This is about the nerve supply as well as, and you know already ये muscles क्या होती हैं. Tensor tympani is what? I've already told you about stapedius. ठीक है? They both are dampeners of sound. ये dampen करेंगे sound. Okay. Now let me go on to the histology of the middle ear. Now everything is a question, okay? Trust me. This is going to be a little difficult for you to grab everything today, but everything is going to come. This lining is very important when we read otitis media. Okay? Let me make the same box. What is the lining of the middle ear? Middle ear has got 3 types of epithelium. 3 epithelium are present in middle ear. Now what are they? What are the 3 types of epithelium in the middle ear? One is pseudostratified ciliated columnar epithelium. Ciliated columnar epithelium. Second is cuboidal epithelium. Third is pavement-like epithelium. Third is pavement-like epithelium. अब simply इसको ऐसे समझो. What is this all about? This is anterior. This is my floor. The anterior wall of my middle ear and the floor, as well as the area around the eustachian tube. You know that the eustachian tube is opening in the anterior wall here. So they all are lined by pseudostratified ciliated columnar epithelium. Now ये क्या होता है? What does this pseudostratified mean? Pseudostratified का मतलब होता है that actually it is a single row of cells, but they appear to be multiple over in the microscope because they have got nucleus at different level. The nucleus of all these cells are at different levels, but actually they are a single row of cells, but they have got nucleus at different level. So we can call it that they have got pseudostratified ciliated columnar epithelium. So if you simply understand what is pseudostratified, it's a single row of cells, but the nucleus of these cells are at different levels. They are ciliated type and they are columnar. They are present in the anterior wall and the floor as well as around the eustachian tube opening. Around the eustachian tube opening. This is what? This is pseudostratified ciliated columnar epithelium. Pseudostratified ciliated columnar epithelium में एक चीज बड़ी इंपॉर्टेंट होती है, and that is they contain goblet cells. You can see that these are goblet shaped cells which you read in your pathology. There are cells which are called as goblet cells because they look like a cup. They look like a cup. That is why we call them as goblet cells. Goblet matlab cup. Goblet of fire you must have heard in Harry Potter. Goblet. They secrete a lot of mucus. They are mucus secreting cells. ये बहुत सारा mucus secrete करते हैं. They secrete a lot of mucus. And that is why whenever you have got a perforation in the ear and the ear is diseased, there is discharge. There is discharge. वो discharge क्या है? That discharge is mucus. And that mucus is coming from where? That mucus is coming from the middle ear, which is lined by pseudostratified ciliated columnar epithelium. That is why ear discharge is mucoid. Middle ear का discharge mucoid होता है. Why do we say mucoid discharge? We simply say that. No, it has a meaning. Why? Because the mucus is coming from these goblet cells whenever they get stimulated. Whenever they are getting stimulated. Okay? When we reach towards the posterior wall, this is the posterior wall, this epithelium becomes more cuboidal. It becomes more cube-like. Or it becomes more cube-like or cuboidal. Ciliated cuboidal. But when it goes towards the roof, जब roof पे जाते हैं और epitympanum में जाते हैं, this becomes pavement-like, flat. It becomes pavement-like or flat. So the epitympanum has got flat epithelium or pavement-like. Posterior wall of the middle ear has got cuboidal ciliary epithelium, as well as the other parts, the anterior wall, the floor, as well as around the eustachian tube, there is pseudostratified ciliated columnar epithelium, which is very rich in goblet cells, which release a lot of mucus, which creates that mucoid discharge. Okay? Chalo. Final thing, we come to the blood supply. Final. Okay? That's last. I know you guys must be tired. Lot of things. I am also tired. You guys must be tired. Okay? So blood supply of the middle ear finishes it all. So let's just write down what are the blood supply of the middle ear. So again, make your middle ear box. This is your middle ear. And I hope now you guys will go into your postings or into your theories, and whenever the lecture is taken on middle ear, whenever you are getting a chance to answer any question, I don't want you all to miss out on a single question of middle ear. I want you all to answer everything whenever your teacher asks you. Because I believe you guys have now mastered the middle ear concept. Majorly, the middle ear is supplied by anterior tympanic artery. Anterior tympanic artery. Okay. This is a branch of maxillary artery. So maxillary artery gives anterior tympanic artery. And the other branch which is giving a lot of supply to the posterior side as well, this is basically the stylomastoid branch, which is a branch of posterior auricular artery. So main two branches I'm telling you, I'm not going into all the branches. There are many small tributary, small vessels as well. Don't worry about those small vessels. But just remember the two major arteries which are supplying the middle ear. That is the anterior tympanic artery, which is a branch of the maxillary artery. And finally, there is a posterior auricular artery, which is giving stylomastoid branch, which is coming into the ear, and that is also supplying the middle ear cavity. These are the two principal arteries supplying our middle ear cavity. There are small contributions from other vessels as well, but you don't need to remember those things. Okay, this is all that you need to remember, and I hope that you guys have dealt about what in all the detail of the middle ear is. So this is what we have read. We have gone from the development, we have gone into the structures, the walls, the ossicles, the muscles, the lining, the blood supply, and that finishes our whole chapter on the middle ear. Huge chapter, and I hope that you guys have understood what has been taught to you, and I hope whatever my efforts were to create a kind of a concept about what is the middle ear is okay. Right. Okay, Anant Krishnal, what is anterior canaliculus? Anterior canaliculus, the other name as canal of huge ear. Okay, same thing. So the posterior canaliculus is the entry point of chorda. Exit point is canal of huge ear or the anterior canaliculus. Okay, that's the other name for that. So I hope you guys have understood about this particular topic. And is there any other question that you need to ask me about the middle ear? Anything that you don't, you're not understanding or you have not understood about any particular concept? Okay, your doubt from before? Okay, so see, I'll tell you again. There is a vertical segment of the facial nerve, okay, that's running in the posterior wall. It will give off chorda tympani. The point where the chorda is coming out from the posterior wall is called as the posterior canaliculus. Now this chorda will come into the middle ear cavity. When it comes into the middle ear cavity, it will run between the malleus and incus, and it will exit out through the anterior canaliculus or the canal of huge ear to supply the anterior 2/3 of the tongue. Okay, so it's coming from the posterior wall, it's going towards the anterior wall. It's coming like this. I hope it's clear. Okay, so any other doubts? I hope you guys have liked it. So can I get a like for the middle ear? Okay, I hope you guys. Stylomastoid foramen. No. Stylomastoid foramen is actually lateral to the floor. You don't need to remember that. I just drew it for your purpose of understanding that the facial nerve is exiting out from the stylomastoid foramen. Okay? So I hope you guys are clear on the middle ear. And I hope you guys are ready for your dinner. Okay? So, great. So, I hope now you have a good dinner. You'll have a good sleep. Lot of things I've loaded in you in the middle ear. But the crux is, I want you all to remember it. I want you all to imagine it and read it again and again. Okay, read it. The more you read it, the better you will become. And we are going to, we are going to, make a lot of images of ENT. We are going to practice images. We are going to draw those things, and many things are coming forward. Okay, this is just intro of what I need to show you. There are many things. When we read facial nerve, I'll cut the whole head and show you what exactly is the facial nerve all about, or what exactly is the inner ear all about. We are going to read a lot of things. Okay, so remember that. Stay tuned and keep reading well. This is all for today. Thank you very much.